Hey, this is Dr. Dewey McWhirter with Tranquility Sleep Specialists. I've got another Dr. Shuteye tip for you today. Today I'm going to be showing you how to set up a nocturnal T3 home sleep test. So a sleep tech will show you how to hook the device up. They'll also give you this nice sheet that goes over how to hook up the device. Really, this video is a backup in case you still need a few tips on how to hook up the device. They're also going to give you this sheet. I think this is an important sheet because it tells you when the device is going to automatically turn on. Usually this will be at 10 o'clock at night. Sometimes they're going to change that time depending on your particular schedule. It also tells you when to return the device, and it does have a link to a video that the manufacturer has put out showing you how to set up the device. So the device usually comes in a little box like this. This is the most important part. This is the actual device that you'll be using that night. It should already have batteries in it. It should also already have this tube attached to it. If this comes out during the night, you simply put it back into this spot where it says press, P-R-E-S, like that. The device does have this microphone on top. That's always important to keep in mind there, that it does really listen once it starts recording. It's also going to come with this long tube here that's really your nasal cannula that's going to go in your nose. It'll also have these straps that you can go around your body. It'll have some backup batteries in it, and it's going to have the oximeter that's going to go on your wrist. So you really want to unpack that device, and then I'll show you the next step. All right, so now I'm going to show you how to actually put the device on. So you're going to use these two little clips here to clip it onto your shirt. It's really going to go in the upper part of your shirt, like so. All right, and then you're going to take the cannula part and you're going to put it in your nose. So you'll see there's these little prongs on here. You want the prongs to kind of curl into your nose like that. So I'm going to put that there. I'm going to put these around my ears. And then once it's on, I'm going to tighten it up like that. But you don't want it to be choking you or anything, just snug. If you have some sort of medical tape or Band-Aids in your house that you know are not going to react with your skin, you can use those right here to kind of keep the cannula in place there during the night. So once you've got this on though, you're going to move on to the straps. You're going to use this first strap that will button on like so. And then it's going to wrap around your body. It's going to be just above the nipple line here. And again, it's going to snap on the opposite side. And you're going to want to use these little adjusters to make it tight enough that when you're inhaling and exhaling, you actually see some expansion and contraction of these. So once you've got that part done, you're going to move on to the other strap, which is going to attach to this little device that hangs down. You can actually, if you want to, wrap this around, but you don't have to do that if you don't want to. You'll see it's got a little spot here where you can actually kind of clip it into place once you've got it wrapped around. It's not really totally necessary though. You will again want to clip this on like so. And then I'm going to wrap it around my body, and at about the level of my belly button here, I'm going to snap it into place. So now I've got those on. The last part, you're going to want to wait to put the oximeter on until you actually are about to start the study, because once you put this on your finger, it's going to turn this device on. And that device will try to communicate with this, but if this is not on yet, then it's not really going to be able to communicate with it. So what you'll do is you'll put this on your wrist. It's got a little medical band on here to hook you up with it so that you have a nice clean non-reusable way of attaching it to your wrist. Then your finger goes on here, and it's not supposed to poke out at the end of this. If it's going like that, that's too far, but you want it kind of towards the end of it. And now that's going to be hooked up. Like I said, this will turn on. This will tell this, okay, we're both hooked in, we're ready to go for the study. And then you'll go to sleep. The biggest thing I would tell you is, even if you've done all this correctly, there's still about a 15 to 20% chance that something might come off during the night. That's always kind of the hard part of these ambulatory studies or home sleep tests, is that at some point something can come off and then you have a test that doesn't really tell you anything. So keep that in mind, but do the best you can to hook up everything together. If you're worried about this coming off, again, you can use some of that medical tape to kind of wrap it around here carefully, as long as you already know that medical tape is not going to react with your skin or anything. So I hope this has been helpful, and I hope this Dr. Shuteye tip will help you to have a successful sleep study. Thank you very much.